Hi, I'm Joe Walz and I'm a psychotherapist at My Therapy NYC. And today I'm going to talk about how to help someone having a panic attack. What is a panic attack? Over 6 million adults in America, that's roughly 2.7% of the population, have panic disorder and experience panic attacks repeatedly. However, as many as 1 in 5 adults may experience at least one panic attack in their lifetime. A panic attack is a sudden, intense episode of overwhelming fear and anxiety. A person's brain and body undergo a fear response, but without the presence of any actual threat. Essentially, a panic attack is a false alarm. The body of the sufferer is unnecessarily going into the fight, flight, or freeze response. Along with being frightening, panic attacks can be confusing, often with no clear cause or way to predict an onset. They may occur in high-stress situations, but also when a person is calm, or even when asleep. How to recognize a panic attack. First, it's important to note that a panic attack can often resemble a heart attack to an outside observer, or even to the person experiencing it. When encountering someone who seems to be having a panic attack, you should first try to determine whether the symptoms have a physical cause or are the result of heightened anxiety or fear. Not everyone experiences panic attacks in the same way. If you know that a friend or loved one experiences panic attacks, it can be helpful to ask them what symptoms they experience. Generally, panic attacks last 5 to 10 minutes, often reaching peak intensity by the 10-minute mark. Some can last as long as 30 minutes and consist of multiple attacks, one after another. Also, the person experiencing one may lose their sense of time. Here are some of the symptoms that may be part of a panic attack. Abdominal distress, chest pain, chills or hot flashes, a choking sensation, dizziness, feeling like you're going crazy, like you're dying, feelings of terror, dread, or doom, heart palpitations, numbness, shaking, shortness of breath. What to do to help someone who's having a panic attack? Remain calm. It may be scary, but try to stay calm. Talk in a calm voice and reassure the sufferer that you won't leave, it won't last long, and that they're safe. Learn the warning signs and symptoms that were outlined earlier. Breathing. Engage in calm, slow, normal breathing that the person can mirror, but don't call attention to it, and do not use a paper bag. That could lead to hyperventilation. Name it. Gently identifying the event as a panic attack can help give the person context for what they're experiencing and help alleviate any fear caused by a new or unknown sensation. Ask how you can help. If this often happens to a person, they may have a standard coping mechanism. You may want to ask in advance if it's a friend or loved one. Also, you may receive a curt response. Don't take offense. It can be difficult to behave logically or politely when suffering a panic attack. Also, the person may want you to leave. You can give them space, but keep watch and let them know that you'll return if they need you. Positive affirmations and conversation can be helpful. Ask questions. Introduce yourself if you don't know the person, and ask if they need help. Ask whether they might be having a panic attack and whether they've had one before. Determine whether to stay or to go. Inform the person that you can help them leave if they want to. It may help alleviate some of the stress. The goal is to be where they're most comfortable. Offer positive, supportive words. Being kind and non-judgmental helps the person to feel safe and to understand that you're there to help. Validate their distress. Offer an empathic response, letting them know that you recognize the difficulty they're facing and are there to help. Help them stay grounded. Assist the person in focusing on what is really happening around them rather than what they fear they're feeling. You can try a variety of grounding actions, chatting calmly and slowly about familiar activities and places, offering a textured object that they can focus on feeling, You could try the 5-4-3-2-1 technique, focusing on things that are in the room and the different senses. 5 items to see, 4 objects to touch, 3 noises to hear, 2 different smells, and 1 taste. Focus questions. What's the day of the week? What's your location? Who are you with? Moving and stretching. Physical touch, if they're comfortable. Repeating a calming or helpful phrase. Simple math. Count to 10 or perform relatively easy calculations. Sitting down in a comfortable chair with feet on the ground. Respect their needs. They may need time afterward to rest and recover. Plans may need to change. Alternatively, if they are up for the plans, continuing with those plans can help reinforce the idea that they can survive a panic attack and continue with their lives as normal. Encourage and assist in finding help. When the attack is over, later, help them find a licensed mental health professional. Recommend self-help books that you may be familiar with. Help them find related support groups. Help them look for other support resources, including organizations like the Anxiety and Depression Association of America. What not to do when someone is having a panic attack. Don't compare panic to common fear and stress. Panic attacks are more severe and may be difficult to understand if you haven't had them before. Don't shame or minimize the person or their experience. Similarly, avoid being critical or judgmental. Avoid saying things like, just relax. There's nothing to be afraid of. You're upset over that. What's wrong with you? Don't say those things. And don't make assumptions. Ask what they need. Don't just assume. And don't give advice. Some techniques, if new, could backfire. Like some breathing techniques could lead to hyperventilation. Don't tell them how to manage symptoms. Just try to assist. When to get help. Generally, time and support are the best things to provide until the attack passes. It may feel like it isn't enough, but it often is. And calling emergency services, when they aren't needed, can make the situation more stressful. As mentioned before, a heart attack or other serious condition could possibly be confused with a panic attack. Try to be mindful of when you may need to call for medical assistance. Here are some of the factors that may indicate you need to call 911. The person never had a panic attack before. They're experiencing chest pain that feels like squeezing, not stabbing, and it moves to the arms and shoulders. They're experiencing chest pressure that lasts more than a few minutes. Their symptoms last for more than 20 minutes and get worse rather than better. They're vomiting. They're losing consciousness. That brings us to the end of our discussion today. Remember, panic attacks can be very frightening and stressful, both for the sufferer and for someone witnessing them. I hope you found this video helpful, and I'd like to invite you to share your comments and thoughts and questions below. And for more information, check out our website at mytherapynyc.com.